So good afternoon. My name is Alicia Wimbush. I am the Program Director of Religious Leaders at the Institute for Islamic, Christian, and Jewish Studies. I would like to thank you for joining us for this afternoon's Lunch and Learn, Chaplains at Community Crossroads. I ask that as you are coming in, if you wouldn't mind putting your name and the organization that you work with, just so that we can get to see who is here with us, that would be great. And if you would just keep yourself on mute as we do our panel discussion, there will be time for Q&A after our discussion. So feel free to type any questions that you might have of the panelists in the chat, and we'll try to get to as many of them as we can after our discussion. So today we have the pleasure of being in conversation with Pastor Susan Beck, Chaplain Asma Hanif, Reverend Alan Siegel, and Reverend Lorraine Brown. They are recipients of the Institute for Islamic, Christian, Jewish Studies First Capacity Building Grant for Spiritual Care Providers. Many of you may know, a couple of years ago, ICJS launched our programming for spiritual care providers. We did research with the Chaplaincy Innovation Lab to see what the needs were of chaplains and spiritual care providers in Maryland. And so one of the needs that was highlighted in that research was resources for spiritual care providers to provide interreligious spiritual care and to be competent in their provision of care. And so at the ICJS, we were able to provide a small grant for chaplains that applied, and they're going to share with you a little bit about the work that they are doing, and even give you all some tips, those who are spiritual care providers, how you can help expand your organization's capacity to meet the needs of the religiously diverse populations that you work with. And so the chaplains and the spiritual care providers that will be on the panel today, they work at the intersection of spirituality, religion, and healthcare, the justice system, and community care. And so I am so excited. Over the past couple of months, I've been able to get to hear about the work that they're doing, and I'm excited for you all to hear from them. And so before we get started, I just want to briefly give some introductions. They'll share a little bit more about themselves and their organizations, but for you all to know who we will be learning with today. So we have Pastor Susan Beck. She is the pastor of the community of St. Dismas Lutheran Church, which is a ministry within the Maryland State Correctional System. Pastor Beck, glad to have you here with us.
Thank you, Courtney.
Yeah. We have Reverend Dr. Alan Siegel, who is a board certified chaplain, a clinical pastoral education supervisor, and director of spiritual care services for the University of Maryland Upper Chesapeake Health System. So Reverend Alan, thank you for being here with us.
Thank you, Alicia. Good afternoon to everyone.
We also have Chaplain Asma Inga Hanif, who is a dedicated activist and healthcare professional. She founded Muslimat Al-Nisa to provide essential health services to underserved women and children, drawing from her extensive experience caring for marginalized communities over 30 years. Chaplain Asma, we are so glad that you're here with us. And we also have the Reverend Dr. Lorraine Brown, who will be joining us shortly. She is the founder and executive director of Project Spirit Sickle Cell, which ensures that young adults living with the diagnosis of sickle cell disease experience internal hope through a community-based spiritual resource designed to support them in managing the complexities of both life and healthcare treatments, aiding them in effectively responding to and managing life's challenges. And so we are so glad to present to you all our four recipients. This is our first cohort of recipients for this capacity building grant. And so we're so glad that they are here with us today. And so I'm actually going to have each of them just share briefly about their organizations and the populations that they work with. And so I'll actually start with you, Pastor Beck. You can start us off.
Well, thank you. My name is, excuse me. My name is Pastor Susan Beck. I caught a cold from my grandchildren last week, so I apologize for the froggy voice. I'm the pastor of the community of St. Dismas. We are vibrant, faith-filled Lutheran congregations, Lutheran/ecumenical congregations that exist within the walls of the Maryland State Prison System. I'm an imposter here. I'm not a chaplain. I admire chaplains. I'm not a chaplain. The chaplains within the Maryland State Prison System are employees of the state. They're administrators. They deal with all the groups. I'm pastor of churches that exist within the prison system, and we currently have 3 active congregations and are looking to open a couple more. What I have in common with all these chaplains is that I'm doing ministry within a secular setting. And when it's one thing to be in a church or a synagogue or a mosque or a temple, and everything is focused toward the religion and the faith and the spirituality. But when the priorities of the institution are different than what your priorities may be. And in my case, it's security. In other cases, it could be healthcare. That brings its own challenges. But what a blessing to be able to bring our spirituality outside of where folks might normally find it. So thank you for bringing me here.
Thank you so much, Pastor Beck. All right, Reverend Allen, would you like to share where you're working and the things that you're doing?
Sure. Thank you, Alicia. So good afternoon, everyone. Thanks for being here. So I am the Director of Spiritual Care for the University of Maryland Upper Chesapeake Health, which is a partner with the University of Maryland Medical System, which is a 14-bed kind of conglomerate, if you will, in the state of Maryland. I'm located up in the Northeast Corridor. Actually, the county, for those of you that have seen the bus accident in the news recently on I-95 in Harford County, it's exactly, we were the trauma response for that bus accident, along with a number of other agencies. So my work has been in chaplaincy for 15 years. I am still a licensed nurse. I became a nurse in 1990. So I've been in healthcare for pretty much my entire adult life. Before I was a nurse, I was a paramedic, City of New York, for a number of years. So a lot of health experience and just kind of watching it shift and change. And if there's anything that was going to define what spiritual care does, or pastoral care, as it's called in other hospitals, is we address the needs, the religious and spiritual needs, but also the needs of suffering. So it's part of my work and part of my role, and you'll see some of it behind me, Rockwell's picture up there, is to anticipate the needs of a diverse spiritual and religious population that may come to your hospital. So being able to anticipate the pastoral or spiritual response, not just to Christianity, but certainly to Judaism, to Islam, to the Hindu, the Sikh community, and to a growing subset of people who are not identifying themselves within a major religious tradition. I don't like the term, but what's being bantered out there in the literature are the nuns. But these are people that are spiritually diverse, as I see them, and to be able even to anticipate those particular needs. So when we received an opportunity to be able to get the grant, what we did is we focused on spiritual items that typically I would not be able to purchase through my hospital budget. And so that grant has served us really well in building a repository of items that will be available for people of different traditions that come to us.
Thank you so much, Reverend Allen. And then Chaplain Asma, would you like to share?
Yeah. Greetings, everyone. I hear what you were saying before, that you said that you were an imposter here. Well, you know what? I would say that I started out as an imposter, in the sense that my focus was nursing. That's what I wanted to go to school for, and it was related to the fact that I had my grandmother died from a preventable condition because nobody cared about her. She was someone that had no status, no money, no resources. She was just a nobody. And I said, you know what, that doesn't seem right. So my mother said to me, she said, go to school to be a nurse, because when people are suffering, they don't care what color you are. And that when I says, okay, that's what I was going to do. So I did. I went to school to be a nurse, and then I tried to be able to establish my own clinic, because I saw that when you go to the hospitals, they still treat you the same way. No offense to anyone, but if you don't have any money or any status, and you just become, just like my grandmother, somebody who they are experimenting on. So you go to the teaching hospitals, and that's what they do. And what I realized is that the only way to make a difference was to be able to have your own. So I established, Alnisa Healthy Solutions, which were my clinic. And how I got into chaplaincy was because the people who would come there, I found that it was a large number of individuals that were victims of domestic violence. And I had no knowledge about any, domestic violence at all, because, I could tell people I kind of backed into it. And then what I realized is that being able to provide just the healthcare, the services was not sufficient. It's just like, what you were just saying, with the Reverend, is that they needed more. They needed some spiritual help to get through it. And the main thing was to not be able to take away their handhold to God, which is the only thing that helped them to survive. So that's the reason why I went back to school to be a chaplain, in order to be able to provide, a full service care to those who were victims of domestic violence, as well as establishing a shelter for them. And my little timer on.
Thank you so much, Chaplain Ozma. It's so interesting, just knowing the background of all of you. You have a background in the healthcare system. And so I know with even with Pastor Beck being a lactation consultant. And so it's interesting to see those connections and even what brought you into doing the spiritual care that you're doing now. So my next question, and Reverend Allen, you kind of touched on this, but as we are seeing the religious landscape of the United States changing, chaplains and spiritual care providers, however you might name yourself, you all are playing an even greater role providing spiritual care and support to individuals that might not be attending religious institutions, whether that be a mosque, a synagogue, a church. And so I would love to hear from you. How do you think this shift has impacted your work? You all are working in a public sector, whether that is in the prison, in the healthcare system, at a shelter for the unhoused. How has this impacted the work that you're doing as spiritual care providers? And we'll go in the same order. Pastor Beck, if you want to start us off.
I think it's impacted us in the sense that we can't be insular. We can't be our own little group. Particularly in a prison situation, we set up, and then sometimes we need to break down and set up somewhere else if something happens. And there's always noise. There's always correctional officers. There's always residents walking by. And sometimes they'll ask, what are you doing? Who are you? That type of thing. And I often find that they are not people who have had a religious background, but they're people with spiritual needs. We are inherently spiritual creations or creatures. And so we talk, are they necessarily interested in coming to our worship service? No, but they are interested in being able to express questions or doubts, or, that undefined connection with the other, that they don't necessarily want to join a religious group, but they just want to talk to us. So I find that happens quite a bit. It also happens with the staff that, there's often misconceptions about just what we're about, and we can get into conversations that way. We also find that, very often again, in a situation, in a context where the priority is not spiritual care, in a prison, the priority is security. It's, we got to make sure that there's no fights and there's no breakouts, and that's the top priority. Spiritual care is kind of it has not been a priority, and I find that the chaplains that they have are hardworking, wonderful people, but overworked, and there's just not enough of them. And they're bogged down with a lot of administrative things that they have to do. Whereas not being officially an employee of the state as a chaplain, I can come in a little early and set up and chat with the COs, chat with the passersby. And not only, I hope it benefits them, but I hope also that it benefits the entire institution, but I know that it benefits me. I learn. Yeah.
Thank you so much. Reverend Allen, let's hear from you.
Right, thank you very much. So it's a great question, and one that we could probably spend hours and days exploring. This is getting people who have migrated out of the traditional religious setting has been getting a lot of attention for a number of years. For me personally, this shift exploded with COVID. When I go back and audit censuses that would list people's religions, it was very rare for somebody to not identify with a particular major tradition. And now it's probably 25% of the hospital. And when you have 250, 300 patients, 25% is a significant population to think about. For me and my team, and I want to give a shout out to Reverend Perez and Reverend Kerr, who are on this call as part of my team, learning. What are these folks teaching us? So being able to go and engage in a conversation and assess what the needs are is really critical. We've got to get out of the traditional religious thinking models in chaplaincy. Chaplaincy was founded on a religious tradition of Christianity. It's 100 years old when you go back to the earliest work of Cabot. But we've got to shift the gears. And a lot of the training that we do at the hospital here, particularly for Christians who are on the team, is to help them get God out of the box and open themselves up to the realities of other people's spiritual walk. I agree with Reverend Susan. Everyone is spiritual. There is not anyone on this planet that's not spiritual when you define it this way. Spirituality is a connection. Myself, others, creation, and if you believe in a transcendent or some mystical force in the universe, God or other name, it's connection. It is about my pursuit of love, joy, happiness. It is about meaning making. And when you define spirituality in its simplest context that way, everybody, in fact, is spiritual because everybody's searching for hope and meaning making and love and looking for those deeper connections. So it's a matter of then beginning to think about chaplain interventions that address those particular fundamental needs in the context of suffering, in the context of anxiety, of anger, of loss, of grief. So the training that I do here and my doctoral work was a concept called PACE. What I discovered was presence, active listening, compassion, and empathy were all interlinked and were linear. You cannot be empathetic unless you're compassionate. Can't be compassionate unless you're an active listener to hear the story. And you cannot be an active listener unless you're present or attuned. So that has become the foundational, work. And then we build on helping people understand then, from my team's perspective, how then do we offer interventions that are not classically religious in a way. That prayer isn't the first intervention. It's working with coping and resiliency. And then discovering whatever that person's religious or spiritual tradition is, and then to bring in elements that person welcomes, those elements into the course of that experience, whether it's ritual, whether it's reading sacred text, whether it's an image on a wall, things that will help that person connect to their walk of life. Not that they have to connect to ours, but what can we do to connect to theirs?
Thank you so much, Reverend Allen. If you wouldn't mind putting that PACE in the chat, I think that's very helpful for us to think about when we're making spiritual assessments and even our interventions. So thank you for a tool to put in our toolkit. Thank you. All right, Chaplain Ozma, how about you?
You know, I was listening to Dr. Siegel, and I was saying, oh my, that's exactly, everything that he was saying is actually what I have been experiencing. And I don't know if it's because of the whole chaplaincy, portion or the nursing portion, but we seem to be very much, like-minded, because one of the things that I realized, like I said, as being a nurse, is that when a person who was a victim of domestic violence would come, faith was I won't say an impediment to their healing, but it was because faith was no longer enough. And that's what I wrote my thesis on, when faith is not enough and you need something more, to be able to say, why did God punish me this way? Why, I was a good person. I was this, I was that. And that's how people related. It related to their faith, that this thing happened to me because either I was a bad person or God didn't find me worthy of being, saved from this dilemma. So then you're right. You have to meet them where they are. I'm not trying to, bring them back from a decision that they have made, because that would be incorrect. And that was one of the things, one of the first lessons that they teach you in chaplaincy, is that you don't have to be right. You just have to be present. And so I had to then, like not make it about their faith tradition, but being present for the pain and the suffering that they were feeling and the conversations that they wanted to have with me. So the nursing became, a greater component, in caring for them than the chaplaincy component, because I had to let them go through what they were going through in order to be able for themselves to heal. Because like I said, like that was the thing, is that, what was most important before was their handhold to God. And now they felt that handhold was loosened. So I feel that when we're there trying to be able to be of any help, you have to meet them where they are, and you have to be able to see what is it that they're needing in order to be able to get through whatever the situation is. And in my case, it was domestic violence.
And I think what's important that you're hearing consistently, Alicia, and to the group that's with us today, is the chaplain has to transcend the chaplain's self. We all belong to a particular religious tradition, and that's wonderful. That works for us.
Yeah.
The importance of not imposing that, or the importance of not locking that experience into my viewpoint, is really critical. To be able to say, I got to get out of my shoes and into this other person's shoes to understand from their worldview what's happening in a way that then I can create the interventions necessary to help them on their path, not an intervention to shift them to my path.
Yeah. Pastor Beck, you're on mute. I know you have something great to say.
Yes, I'm thinking about, and Chaplain Hanif, I'm sure you've encountered women who have been injured by religious establishments, are wounded. And Chaplain Allen or Reverend Allen, when you we're talking about the shift that years ago, almost everybody registered as something, and now there's that unfortunate term, none. So many folks have been injured by religion. So many folks have been injured. And I think for a long time, you couldn't speak up against the established religions. So that was pushed under the surface, but now people are coming forward with it. And I'm thinking particularly women, survivors of abuse, the LGBTQ community. They've all been wounded by religion, and any sign of religion is triggering. I remember one time I usually wear a collar and go into the prison, but we're having a special service, and I thought, I'm gonna bring my vestments, and we're gonna make it all fancy and all that. And I don't do that too often because it's a pain to get them through security. But I remember one man came up he was curious about the service. He saw me in my vestments and went, oh, and bolted. And I think it was just triggering. This was too much religious symbolism. I realized, okay, we need to understand that and meet the spiritual needs and address that without thinking, well, everybody's got to be part of religion, because religion hurts sometimes.
And you're speaking about the optics.
Yeah.
I don't wear a collar here because I don't know if my collar is going to trigger somebody. And our trauma-laden world today, particularly for groups that religion has been hurtful to them. What I discovered during COVID, when the churches opened up and people didn't go back, because there's another subgroup here. There's people that don't prescribe to a religious tradition, but there's also a number of people that were, and particularly Christianity, who have not come back to their Christian churches. So in the hospital setting, not only are we responding to the folks that have non-religious traditions, but also to a large number of Christians. And I would suggest maybe even 30% of our Christian population who are no longer going to church and are relying then on the chaplain to be that person to help them with their particular Christian religious needs. So there's this other group that has evolved out of COVID as well that we're not really speaking of too much.
Thank you. Go ahead, Chaplain Asma.
Yeah, something when we were talking about the with me, because that's my focus was victims of domestic violence. When I was doing my research, and then I would go to the faith leaders, because what I found out is that that's generally who somebody would choose when they're a victim of domestic violence, would go to their, whoever their faith leader is. So when I went in, I would ask the questions. One of the things that I found that was, for the majority of the faith leaders, they would say, well, where's this victim of domestic violence? Nobody would believe them. Nobody would believe them. And that's what, causes the breakdown, is that somebody, that here you are being abused and someone is treating you, as if you're lying. That's the first thing. Or they would have, not having any type of training in terms of chaplaincy, even though they may be faith leaders, they would say, go back and I'll speak with him. And what they didn't realize in doing that, which was the wrong decision, and anybody knows who's dealing with people having health disparities, was that basically what they did was sign her death certificate. Because of the fact that now what he's doing is that he's not believing her, and he's saying he's going to counsel the person who he doesn't believe hurt her anyway. And the last part that I wanted to say with this is that there was one faith leader, and he said to me, and I tell people, this was the nice, he was the nicest, well, not the nicest one, but he said, okay, what did she do to make him beat her? And I tell people, say, well, Asma, how is that the best statement? I said, because he was the only one who admitted she had gotten beaten.
All of
He wasn't helpful, but that was a step up from the other people who said she was lying.
Yeah. Chaplain Asma, thank you so much for sharing that. And all of you are really pointing to this need for this type of training, for us to be competent, religious, spiritual leaders, and not, blame the victim or send that person back into a harmful situation. And so again, this work of spiritual care is so important. And having those questions when people are doubting, when people are, they have experienced hurt in religious institutions, oftentimes, they might not go back to that religious leader to talk about that hurt, but they might encounter you as spiritual care providers and say, you know what? I'm done with religion because this was my experience. And so thank you all just for bringing up those examples and helping us to see how we do have to get out that box. I love what you said, Reverend Allen, getting God out of the box and not having people, come to, our understanding of religion or spirituality, but really meeting them where they're at. So that's very helpful. And it actually leads me to my next question about what are some of the misconceptions of spirituality and religion in your organizations? We know that we have people that might have come out of a specific religious tradition and they might not have gone back, whether that's due to COVID, whether that's due to just a situation that was harmful. But what are some misconceptions that you're finding in the places where you're working? And how are you dealing with those misconceptions? We'll start with you again, Pastor Beck. You kind of mentioned some of them already, so.
Yeah, the misconceptions are, people will look at us and will make assumptions. Well, you're exclusive. You all think you're the only ones going to heaven, and I'm not going to see you in the afterlife because according to you, I'm going to hell. So often I've been told, oh, well, I can look at you and tell you're homophobic. Oh, I can look at you and tell that you're racist. So there are these misconceptions. I have a great story. Last week, I went into one of our prisons, and most prisons don't put a lot of stock into landscaping or anything, but this particular prison has a little garden right outside the chapel area that the residents will tend to. And there was a man out there tending to the garden. It looked lovely, and I complimented. I said, "Oh my goodness, this is such a beautiful spot. You've done such a nice job here." Turns out he was of the nativist, Native American faith, and he said, "Oh, are you Catholic?" I said, "Nah, I'm not Catholic. No, not that I said we're Lutherans. We come from the Catholic tradition, but there's a lot of there are some distinctions." And he said, "Well, I know, so then he started to talk about all these misconceptions that he had. And I said, "Oh," and how, he believes in a great spirit. He believes in a mediator between that, we might call Jesus or whatever. And I said, oh, that's what we believe. But can you tell me more about yours? I said, I know, what's your take on that? Tell me more about that. And I heard such beautiful descriptions of the divine and descriptions of connection, of how to connect. Now, is that our Lutheran doctrine? No, it's not. But I was so very informed. And, I had some time, and this was before the service, I had some time to kill while the men were gathering. And what a lovely way to start our worship service, that I was able to come in with these new ideas. And they're, in prisons like nursing homes or hospitals or a lot of situations like that, people are confined. It's not like you can decide, you know what, I don't like that person, I'm going to get up and walk away. No, you're not going to do that. So you learn to get along or not. So they do listen to each other. And by listening to this man, I learned some stuff. I might have had some misconceptions about him that never would have been cleared up if I hadn't shut up and listened.
Thank you so much, Pastor Beck. And I appreciate your openness. And I think that's a part of what it means to be a spiritual leader, to be open and to learn from other people. So thank you for that. Before I go to Reverend Allen, I just want to say welcome to Reverend Dr. Lorraine Brown. Thank you so much for joining us. I will have you introduce yourself and the project that you have launched. Yep, you can go right now. You can go ahead and unmute yourself. There you go.
Good afternoon, everyone. I apologize for my tardiness. I am Reverend Dr. Lorraine Brown. I am the founder and executive director for Project Spirit Sickle Cell, which is an organization that was founded in 2015 as a research project, and in 2021 became a community-based spiritual support organization. The Spirit and Project Spirit stands for Sickle Cell Pastoral Intervention, Reaching Individuals in Transition. And our goal originally was to begin reaching individuals between the age of 18 and 28. They're a hard group to reach, but we did the best we could. And what we found is that there are other age groups that are also in need of spiritual support. We have been, since 2021, providing one-on-one chaplaincy for individuals who would like to have just a one-on-one time. We provide a support group, which once a month, where they can come and share with each other. And we also have a podcast, which is on hiatus right now, so that these individuals whose voices are usually compromised are able to be heard by the community at large regarding just how they're living. And for some of them, they don't always have a spiritual place to vent. Their friends aren't spiritual. And here they found a source where they can actually share together about the meaning of their life and the meaning of what God had in plan for them and what they had in store for them. And so that's the Project Spirit Sickle Cell.
Thank you so much, Reverend Brown, and I'm glad you were able to join us. I was just asking the group to share about some of the misconceptions in their organization around religion and spirituality. And so I'll have Reverend Allen, you can go ahead.
Thank you. Reverend Lorraine, it's good to see you. We have some of our clients that overlap each other. She is a staunch advocate in the sickle cell community where it's so needed. That group is still struggling with the recognition of their needs in our 21st century hospital settings.
Mm-hmm.
So misconceptions, it's a great question. For those of you who don't know about, I will say, hospital chaplaincy, we are required to go through 1,600 hours of training, 400 didactic hours, 1,200 clinical hours. You have to have, at a minimum, if you want to be fully board certified, your master's. So there's a lot of work and preparation that goes into professional chaplaincy. You go through a program called clinical pastoral education. The first challenge I see for chaplains is defining themselves. You go and introduce yourself and somebody says, well, I don't know what a chaplain is. So there's a whole bunch of conception ideas about what chaplaincy is, and rightly so, because we are now everywhere. We're in the corporate environment. Certainly we're in all the paramilitary services, the military, the hospital, healthcare. So you're seeing this broad range of chaplaincy being defined by the very institutions that they find themselves. So there's a diversity there of definition. I spend a lot of time explaining what a chaplain is, probably too much time from a immediacy standpoint. I found it much easier now to just identify myself once I was ordained, say, I'm Reverend Thaddeus. Oh, great, welcome. And all that other stuff goes away instantly, particularly for anyone that knows what a minister is. The other conception is we're only around for end of life or death. And we're around for a lot more than that. That we're the prayer-focused intervention team. That's our job, just to go and pray for somebody. We don't have any other seat at the table. And that we're a Bible delivery service. When you asked that question, that was the first four that came to my mind, and I'm sure other chaplains that are either here joining us or in the panel could add more to that.
Thank you so much. Yeah. And if you do have some misconceptions about what you do, we would love to hear them. You can put them in the chat box. Chaplain Ozma, I'll go to you, and then Reverend Brown, if you also want to share some of the misconceptions you've faced.
I was listening to, like Reverend Siegel, and I think about, you're right, it's a lot of work to become a chaplain, because I think about all of I had to do, the 2 years of, pastoral, and I did mine at the Jewish Theological Seminary. And, like, I was like 6 years, all of the things that he said that you had to do is correct. It took a lot of work. And one of the things that it helped me, because I was at Harvard Seminary, so I was able to study with Muslims, Christians, and and the Jewish community. So one of the misconceptions that in terms of domestic violence, which is, like I said, my focus, is that those who that may stay in the relationship, they feel as if, well, that's their path to God. That, like suffering, they said they're suffering, so it will be, like God will, vindicate them, when they die. And I tell people, I said, you know what, when I'm talking to them, that I've studied all the faith traditions, I don't find that to be true. That, that just because because you did all this suffering, all right, that you have a guaranteed, road into paradise or to heaven. I says, but I said, if nothing else, said, there's so many other paths. I said, instead of just staying in an abusive relationship, I said, you know what, pick another path, because I know it's more than one. When I did the studies, and that is to me the greatest misconception relative to my work, is that the women that stay is because they feel that like that God ordained this to be their trial in life, and it will be their way to get to heaven.
And Chaplain Ozma, it's interesting because sometimes that type of messaging can come over.
Yes, it does.
Religious leaders are sharing that type of messaging. And so you're right about some of the misconceptions that you have to face, and even talk with the person to say, like you said, choose another way,
But that's who gave it to them. That's who told them that when they would go to, to the religious leaders, whether it's, like an imam, a pastor, a rabbi, or whoever, then they tell them, what, just stay there, be patient, that, God's going to vindicate you. That's why they stay. Nobody would just want to be born, and nobody's born into society thinking that, okay, yes, you got to suffer in order to get to heaven. Someone told you that, and they were wrong.
Mm-hmm. Yes, go ahead, Reverend Allen.
Yeah.
There was a patient I recently met with who was told when she left her domestic violence situation 40 years ago that she was going to burn in hell when she died because she left her husband. And when our doctors here told her that she had a few months to live, the voice that she heard was no longer the doctor's, but she heard that pastor's voice from 40 years ago telling her, now you're going to burn in hell. And we did a lot of work with her, and we were able to shift that perspective. We didn't take away that experience. We didn't deny that truth of that, but we introduced other elements and other ways for her to look at that same circumstance, which she found the grace and the gift in, and no longer heard that pastor's voice. But this is the danger when it happens. Yeah, what can happen.
Thank you, Reverend Allen. And just again, for those who are new to the chaplaincy world and the work that they do, just thinking about the tool to reframe. And it sounds like you were able to give her a reframe so that at the end of her life, she's not thinking she's going to a terrible place. And so again, that's the work of chaplaincy. That's the work of spiritual care. So thank you for that. Reverend Brown, how about for you? What misconceptions about religion, spirituality, your role as a chaplain have you faced in your work or your organization?
So when we first began this work, I did my doctorate in the area of spirituality and sickle cell disease at an outpatient clinic at one of the Maryland local hospitals. And they had not thought to do that concept of going to the outpatient, because chaplaincy has always been inpatient. You got to see somebody. And so this was something a little bit different. However, of course, time and person power did not allow them to be able to be outpatient. This happened to be a specific area. But with the population that we're working with, as clients are in the hospital, they might see a chaplain, they may not see the same chaplain again. And so there were inconsistencies where this population really needed to have more consistency of someone who would, they could develop a relationship with, even though it wouldn't be long term, but just some kind of relationship. So when we put together the idea that we were going to do this community-based kind of chaplaincy, first of all, it was a little bit of a different idea, because basically chaplaincy was seen to be in the hospital, and here we are trying to have a community. So when mentioning that we can have chaplains, and people go, yeah, I want a chaplain, and then the question would be, what is a chaplain? And there was not a real understanding of what a chaplain is. All they knew is, yay, it's not a minister, it's not a pastor, so yeah, I'll go with the chaplain. And then as we kept on perceiving, they thought, well, the chaplain is still going to be a Bible study, Bible thumping, trying to get us into, join the church. And that's not what we're about. We really are about, I say, spirituality is reality. We try to be real. I mean, the conversations that some of them have can cause some people's face to redden, and you just like, oh my goodness. But that's the reality of people's spiritual life. It doesn't have to follow a certain order with some certain guidelines of do's and don'ts. We allow people to be their authentic true self. And through that authentic self, their spiritual self evolves. The real piece is still trying to differentiate between religion and religiosity and spirituality. And for the community I'm working with right now, those two bump heads. But what also bumps heads is the mental health, the emotional health, and there's and spiritual health. We'll tag on the word, but then they keep on down the road of just kind of defining those things that are related to emotional and spiritual health. Emotional and mental health, but spirituality is only there in essence in a word, because people don't know how to define it. They don't know how to actualize it. They don't know how to put it into a practice. And in the world that I'm in right now, I'm really trying to help people understand that spirituality is something of our very being. It doesn't mean you have to go to an institution. You don't have to have a certain belief. You don't have to use a certain book. It is who you are as a person, and where the higher power, whatever that force is in your life, that is leading you to do the things that are going to be meaningful for other people in your life. And people with sickle cell disease know that, and they have done some meaningful things, but they have never been allowed to be able to even show it, because people just think that their disease makes them less than and with disabilities.
Reverend Lorraine, thank you. What I'm hearing in your voice is the creation of relationship, that consistency
Community.
and that relationship. And, it makes me think about it, in my context, we define ourselves as congregations, and not as a prison ministry that goes in, does our thing and leaves, because we want to form relationship. And I find, technically, according to the Maryland DPSCS, I go in there and I am to do a worship service, I am to do a Bible study, boom, 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 I'm not to do anything else. But we're allowed a half an hour before and a half an hour after for setup and cleanup. And those are the most the most precious and productive and blessed times, because that's when we form relationships. And I'm very often guilty of starting the worship service late, because that connection and listening, I mean, people, incarcerated persons, nobody listens to them. People talk at them, people tell them what to do, but nobody listens. And to have someone who week to week remembers, oh, last week you were worried because you've got a parole hearing coming up, or one of your kids is sick and you can't be there with them. How are they doing? What's the update on your parole date? That is really, really valuable. And there's times I have to cut the worship service short, because when count comes. You can't be incarcerated and not be in your bunk when count comes around. But I think that's so much. It's as valuable, if not more valuable, than the actual worship service or Bible study that we do. So it's building relationships with those who, and listening to those who have not been listened to, and their suffering has not been acknowledged, just like you said, Reverend Lorraine.
Yes, indeed. Thank you, Susan.
Thank you so much. This has already been such a rich conversation, and we have some great questions that the community here have wanted to ask you all. So I'm going to shift gears. I know I had a lot of other questions I was going to ask you all, but I think it's important for us to hear the questions from this community, and hopefully you all feel comfortable addressing them. We have some really good ones. So, and anybody can jump in here. The first one is, as a board certified chaplain, a certification volunteer, I see chaplains who apply and discuss the FICA spiritual assessment tool. I don't know if you all are familiar with that, but it stands for Faith, Importance, Community, Address. As we discuss assessment tools with certification applicants, how can we modify this and other tools to address the spirituality of nuns, those who are religiously unaffiliated? Or do we need to develop new assessment tools? And I think Reverend Allen, I don't know if you want to share what you shared even earlier, but if there's any other tools that you all have, I would love to hear them.
So I think that's a great question. Thank you for asking it. There are a number of different, what we call assessment tools in chaplaincy. There's probably 6 or 7 that are used often, that are taught often in CPE programs. I love FICA because even though it's kind of pointing to religion, I can shift that a little bit and focus on meaning and purpose, spiritual tradition, what moves you. There's an author by the name of Lucas called The Disciplines, in which his focus is on meaning. And to me, that's where the real rubber hits the road. If we can help somebody tell us their meanings in life, where they get their strength from, where they get their hope from, their coping skills or resiliency level, that allows me to kind of transcend religion and to really focus on the everyday drivers. So think about Maslow's triangle. Think about Bowlby's theory of attachment. These theorists that have come along and said these really work with the human condition, and they transcend spirituality, religion. So any assessment tool that allows you to get to that point, you could modify it certainly to be able to tune it to your own approach, but there are tools out there that you can easily adapt to that get past the religion concept.
Thank you, Reverend Allen. I don't know if anybody else wanted to weigh in on that. All right. So I have a question. As chaplains, the community would love to hear, how do your personal religious beliefs, spiritual beliefs, and values inform your work? So as chaplains, as spiritual care providers, how does your personal religious beliefs or spiritual beliefs inform your work?
Something that I would like to speak on, and it's always, those sensitive subjects that you don't always, put out there in the public. But when individuals first came to me, as patients, and told me that they were victims of domestic violence, this was before I had the shelter. And then I was telling them, oh, there's shelters for victims of domestic violence, apply there. They had funding and all like this. And something that the women said to me, and I don't know what places they went to, But they said that when they went to those shelters, they were told that you're a part of that religion that says it's okay to beat women. So therefore, if you want our help, you have to accept Jesus Christ as your Lord and Savior, and go to, Sunday school, and convert. Otherwise, we won't help you. And that was my main incentive for actually starting the shelter, because I said, that was basically they're telling them you got to sell your soul or your beliefs in order to be able to, save your life. And I thought that was unfair and unjust. And so since that time, how it's also changed, because since then I've gone to school to be a chaplain, is that when I go and speak, that my main topic, my mantra is domestic violence is criminal, not religious, because I know that to be a fact. Because I'm not trying to change anybody's handhold to God, but I thought that all that anybody wants to do is when they go, whether they're Muslim, Christian, Jewish, or whatever they want to call it, none, an unknown person, is to be able to have a safe place to be. It has nothing to do with your faith tradition. You just don't want to be killed. You don't want to be abused. So that's what has changed, what it relates to what I do.
Mhm.
Thank you so much.
Well, Chaplain Haniff, I'll tell you, there are Christian leaders who are guilty of, just patting the woman on the head and saying, well, this, you have to be loyal and you have to, stay in those situations. And, I know women who have done that, and they took it. I mean, women in my congregations, they took it until one night they didn't, and now they're lifers. Yeah, how many of us wouldn't have reacted in such a way? So I'm grateful for your work.
Lisa, could you just ask that question one more time, please?
Yes, I was just asking, how has your personal religious or spiritual beliefs or even values really informed your work? And as we listen to Chaplain Ozma, I feel like her work is such grounded in love for humanity. And so that's a value I hear, just even her sharing these stories, is she has a love for humanity and she doesn't want to see women or anybody abused. And so if there's any value that you ground your work in, we would love to hear.
Well, I ground my work in the teachings of Jesus, that the least, the lost, the left behind, and that so many of this population, especially African Americans in general, we know that there's disparities, but this population in general has had such a hard time with people seeing them as people, because all they see is that they're possibly drug seekers or whatever. And my heart has always been for those who seem to be on the fringes, who don't seem to be able, even as much as they try to find that door to get in, they can't find the door. If there is a door, there's something blocking the way. And I've always been for the least, the lost, and the left behind. And there are so many, if just given an opportunity. And as we know, sickle cell disease doesn't just affect African Americans. Everybody, male, female, from any social economical background, from any ethnicity, because it actually started in the Mediterranean area of the sub-Saharan area with Italy and Greece. There are people of all different walks of life who have sickle cell disease. It just so happens that the majority are those who are African American. And so then it's been labeled as a Black disease. And being labeled a Black disease, when come to an emergency room, people don't believe them, they don't want to treat them. There's so many things that happen. And my mantra is to empower people to know that they have a voice, they have power, and they can do. And just some of the strategies for doing it, it's just lifting up a group of people that others would not necessarily lift up.
Thank you so much, Reverend Brown. I love that, your mantra, the least, the lost, the left behind. And we definitely see that you are living by that mantra. So thank you. We have about 5 more minutes, and you all have asked some amazing questions. Thank you all for the resources you're putting in the chat box. I see them. Thank you so much. This is definitely an opportunity for us to share as a community. So if there's other resources that you have, I would like to ask the panelists. I know there are resources that you all purchased with the grant money that you received. If you want to put just titles of books or even conferences that you all went to in the chat box to share with this community, maybe they might be interested in exploring those resources as well. You can go ahead and do that. But with the last 4 minutes, I would love each of you in 1 word or 2, if you can condense it to 2 words. I would love for you all to share what is the most rewarding part of your work. You all are standing in the intersections of spirituality, religion, and the healthcare system, the correctional system, in shelters. What is the most rewarding part of standing in that intersection and meeting people right where they are? And so if you can do that in 2 words, that's great. We'll start with Pastor Beck again, and we'll go around.
I would say that the most rewarding thing is, beloved humanness. That's what I discover all the time. That there are people that, just the fact that someone's been incarcerated and they have a felony conviction, they're labeled for life and they live under that label, but God sees them as beloved, as a beloved child. And there's the human connections and finding that there is belovedness in each human being. That's the greatest reward.
Thank you. I love that. Anybody else? 2 words, the most rewarding part of your work.
Forming community. And the reason is because some of these people have come from isolated places where they did not know other people who have living with sickle cell. And then they found out about us, but they still stayed somewhat to themselves until they really started hearing, oh, there's similarities, overlap, there's other people like me. And now they find this a safe space. So it's really about having a safe community, which is very similar to that connection. But now this is their group, and they know, like someone was saying, that you can ask a question, or just if somebody remembers. Susan, you were saying remembering somebody, what's happening with their family, and a chance for them to share. It's all about community.
I would say spiritual empowerment, and be able to come through what they've gone through and know that God still loves them. They're still the child of God.
Thank you.
And for me, it's sojourning,
Mm.
just being a sojourner with others. Just one other comment is that I think Edna's got a question in there that might be really relevant. I don't know if we're able to answer that very quickly.
Can you read the question?
I'm going back. I think it was, how can we, sorry, Edna, let me go back. How can we address concerns, immediate concerns, without drawing upon religious narratives? Edna has a great question. I don't know if we can be attentive to it in the time that we have left.
We have 1 minute left. I don't know if she would be willing to share her information with you. You all can chat offline about that. I want to be mindful of everybody's time, but that is a wonderful question. And actually, I would love to share that next month, we're actually going to be having an entire lunch and learn dedicated to this question about how do we provide spiritual care to those who are no longer affiliated with a particular religion. And I feel like we've spoken a lot about that. Reverend Allen, like you said, we probably could have spent this whole time talking about that. So if you are interested in really thinking critically about how are we providing care for those who have been hurt by their religious institution or given messages of harm in their religious institutions, we invite you to join us on June 10th. We will be speaking to Reverend Dr. Sue Yoder, who has been in ministry for 40 years, but over the past 5 years, she's really been exploring this question about creating community for those who might not be a part of a religious institution. So I just want to put a plug in there. And again, if you do want to get in contact with our panelists, feel free, you can put your email information in the chat box and we can share that information. If there were questions that you just had burning in your heart that we didn't get to, feel free to share your information with them and you can exchange contact and continue the conversation. And again, thank you so much. And we hope to see you for our upcoming events. You have a wonderful day.